For more on this, we're joined by Dr. Mads Gilbert. He's a professor of emergency medicine at Norway's University of Tromso and has been training junior doctors in Gaza for the past 20 years. Doctor, it's always good to speak to you on this news hour. Firstly, what is the broader impact of what we're seeing happen to the medical facilities in Gaza right now, including things like the killing of 8 first responders, so critical, of course, to getting to those who have survived any attacks and getting them to the emergency needs that they will require in order to get better. But after almost 18 months of war, the impact must be monumental.
It is, absolutely. So to give you a clear answer, the result of the Israeli illegal criminal attacks on the Palestinian healthcare, not only the hospitals, but of course also the pre-hospital emergency medical services. The effect is that more people are killed, very simply, because there is nobody there to stop the bleeding or to open the airway, or the hospital will not have the needed equipment, drugs, and surgical capacity to save what can be saved. There is an expression in medicine called avoidable death, which means people die unnecessarily. It could have been prevented had the healthcare system been able to function normally. That's what we see in our societies. You have a myocardial infarction, an ambulance is coming, you're taken to a hospital, you're given first-class treatment. You have a car accident, somebody is coming to stop the bleeding, the ambulance, the air ambulance, the hospitals are functioning. We save lives in that way. What the Israelis are doing, the Israeli occupation army, is actually to bleed the medical system in Gaza so much that lots and lots of people are dying unnecessarily, even given the dire situation. Had the medical system functioned, lots of people, not only the trauma patients, but also those with chronic illnesses like kidney failure, cancer, psychiatric disorders, infections, and so on, will now die because of these completely illegal Israeli attacks on the healthcare system. And the latest news about the 15 bodies being recovered in Rafah, dug out in their uniforms, with their gloves on, being there to save lives. It is such an abhorrent crime against humanity that it is, I'm almost left speechless. And don't forget, if you look at the UN latest numbers, so far, the Israeli occupation army during the last 17 months have killed more than 1,060 healthcare workers. They have killed 110 civil service, civil defense workers. They have killed almost 400 other aid workers, and not to forget, 206 journalists. Altogether, close to 1,700 staff that are protected under international law, and everything has been documented, thanks to you journalists. Everything has been documented almost live, and the Western world is still sitting idle, not stopping Israel.
Doctor, as somebody who has worked in Gaza for 2 decades, you've trained so many doctors there. Is there any type of training that you would have been able to provide to medical staff there to actually equip them with what they're dealing with now, not just the wartime conditions, but even being in a medical facility and treating someone without having enough supplies, without having the correct supplies, because aid hasn't been able to enter for weeks now?
Look, the surgeons, the medical doctors, the nurses, the paramedics, and the medical students in Gaza, they are the world experts. I have learned from them. I've not been able to teach them very much, which they can use during this very difficult situation with the combination of siege, lack of equipment, lack of supply chains, lack of energy, water, food for the hospitals, and lack of surgical equipment and drugs. So actually, if we should ask someone for expertise, we always have to ask the Palestinian healthcare workers. What I have been lucky to to be able to is to train medical students and to work together with the brilliant Palestinian medical staff in the hospitals and the ambulance services. I've known them for 40 years, and I've seen them, how they have developed their techniques in order exactly to meet what you point to, the very limited resources. There's nobody else on this planet who are more experts on handling these crisis situations, and they are actually saving lives every day. Half of the hospitals in Gaza are still operative, thanks to the brilliant leadership of Dr. Youssef Aburish and the Minister of Health. The functions in the hospitals are operative thanks to the Palestinian healthcare workers, not thanks to some white doctors coming for a week or two. So we have to respect and understand that what we can do now is, by protecting the healthcare system in Gaza through a ceasefire, they can be quickly restored to a high level of function. The problem is that Israel is systematically attacking healthcare, which is illegal, of course. They are systematically killing healthcare workers, and not at least the pre-hospital workers, both civil defense and not at least the Palestinian Red Crescent Society, paramedics, and the doctors working pre-hospital. That has to be stopped, and that has to be stopped by sanctions and economical isolation of Israel. That's the only language they understand, unfortunately.
Dr. Mads Gilbert, always good to get your analysis. Thank you, as always, for speaking to us.